Hello everyone. Here we are going to discuss a small topic that is lung abscess. So you get a short question or very short question on that, especially on the causes, clinical feature and complications. So let's start the topic. We are starting, that is lung abscess. So I will discuss this topic under following headings. First, I will let you know the definition of lung abscess, then the causative organism, its causes, clinical feature and complications. It's a small topic. You get short or very short note on that. So let's start the definition. What is lung abscess? So abscess anywhere in human body, that means the accumulation of pus in that particular tissue. So lung abscess, it is the accumulation of pus inside the lung tissue. So that is the lung abscess. There is a localized suppurative necrosis of the lung tissue. So inside the lung, you can see there is a localized suppurative action. So there is a collection of pus, a bag of pus, a small focus of the pus in the lung tissue, that is known as lung abscess. So that is the meaning of the lung abscess. Can you name the organism? The most common organism causing lung abscess is anaerobe. So there is an MCQ on this also. The most common organism causing lung abscess is anaerobe, and other bacteria can also cause it, like gram-negative bacteria, staphylococcus, streptococcus. Among the causes, the most important cause is aspiration. What do you mean by aspiration? You know, we have a structure in the neck that is known as pharynx. You know that? So there is pharynx. From the pharynx, two openings are there. One opening is the air pipe, that is trachea, and one is food pipe, that is esophagus. So from pharynx, both are arising. Okay, so this is trachea, this is esophagus. Trachea is the air pipe from which we inhale, we exhale. It is going in the lung. So the trachea is going in the lung and dividing into bronchi, bronchioles, like that. And esophagus is going and continuing in the stomach and the intestine. So this is the GIT. But there is a common opening. The common is pharynx in them. So whenever we eat, at that time, the trachea is covered, the larynx, over the trachea there is larynx, and larynx is covered with epiglottis. So epiglottis cover the lumen of the trachea, the larynx and the trachea. So whenever we eat, at that time the epiglottis is closed, so that food is only diverted into the stomach. But whenever we are eating, at the time we should not talk. So my mother always says that stop, you should keep quiet whenever you are eating, don't talk. So I don't understand when I was a kid, but now I can understand why she always scold me whenever I talk while eating. Because when we talk while eating, now the epiglottis open. Whenever the epiglottis opens, so food can enter here also. So that is known as aspiration, the entry of the food in the air pipe. The food should enter in the food pipe, that is in the esophagus and the stomach. But whenever the food enter in the trachea, the food will go here, and that can cause the lung abscess. The most common cause is aspiration. So this is the meaning of the aspiration. Aspiration is the most common cause of lung abscess. Aspiration of oropharyngeal secretions can be there along with the food. The second cause is the antecedent primary bacterial infection. There can be some septic emboli, which is coming from the right-sided endocarditis. There can be some obstructive tumors or direct traumatic punctures can be there. But most common cause is aspiration. What are the clinical features? Patient have high-grade fever along with cough, along with foul smelling sputum and the chest pain. So the symptoms are very simple. You can correlate with the lung abscess. So there is the abscess in the lung, the pus collection in the lung. That's why patient have a chest pain, patient have cough, the foul smelling sputum is coming and fever is there. Now complication, it can extend into the pleural cavity. It can the pus will continue in the pleural cavity. Hemorrhage can be there, septic embolization can be there, or secondary amyloidosis can be there. So these are the complications you can see. So that's all about lung abscess. It's a very small topic. You will get short or very short note on that. Thank you.